Good morning and welcome to another Ministry of Health virtual media conference on COVID-19. I'm pleased to introduce to you this morning the Honorable Terrence Deyalsingh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Miriam Richards, Principal Medical Officer Institutions at the Ministry of Health. I'm Candice Alcantara, Manager Corporate Communication at the Ministry. And we go now to the status update from Dr. Roshan Parasram, CMO.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to the Honourable Minister, Dr. Richards, members of the media, members of the viewing and listening public. The COVID-19 update as of the 6th of August 2021 is as follows. For public and private facilities, so far tests done 277,082. The taking our total number of positive cases thus far to 39,835, having reported 258 new positives over the last 24 hours. Our total recovered patients are now 32,802. Total active cases stand at 5,910. Those persons in home isolation as a subset of that at 5,257. Those in hospital, 313, and those in step-down, 82. Persons in state quarantine at this time, 168, and the total number of deaths now stand at 1,123. The Honourable Minister will go into detail in terms of the vaccination statistics. If I could have my next slide, please. So this is the normal epidemiological curve, beginning all the way on the left for Trinidad and Tobago. Just to say that we are now at an average, 7-day rolling average of 183. We have been in that sort of range, less than 200 now, for about 2 to 3 weeks. Continue to be in that sort of 190, 180, 200 range. So it's continuing in that plateau that we have been known to see. If you look at the dark colored graph on the right, you will see one spike which goes above that, which goes into the 300s a couple of days ago. Other than that, we have maintained in the plateau. Next slide. So this slide basically gives you an idea by county, a breakdown as to the number of cases week on week, what is happening. So if you start on the left with the bluer color, we are weeks 25, the orange will give you week 26, the gray is week 27, the yellow bar week 20, the turquoise bar 29, and the green bar the right hand side, it's week 20, which would have been last week. So looking from the left, we look at Caroni, we're seeing the second to last bar, which is the blue bar, a little higher than the green bar, which for this week shows a slight decrease. But again, it is consistent with if you look at the yellow bar and the grey bar before that, pretty consistent with the number of cases in that particular county. So Caroni remains high comparatively in terms of number of cases, just over 225 cases in County Caroni. River-Mayaro remains more or less in a very good state in terms of the number of cases, very low number of cases in the River-Mayaro. Similarly, St. Andrew, St. David is controlling well in terms of the number of cases. Over the last 2 weeks, we have seen a decline continuing in St. Andrew, St. David to just over 50 cases noted. St. George Central, again, we are seeing a decrease in St. George Central. St. George East seems to be maintaining in a bit of a plateau, which is mirroring the national picture that we saw in the epidemiological curve. St. George West, we have noted in decreases. St. Patrick has begun, although it was in a plateau phase, has started to decrease as well. Tobago, we noted a significant increase in week 29, and again an increase in 30, a little bit less so far than week 29, but still high for Tobago. And in the County Victoria, we are seeing a large proportion of the cases coming from County Victoria. And if you notice, the last bar of green on the right is higher than the blue bar. We're still seeing an increase, which means that the number of cases coming into the county is greater than the number of discharges that we're having. And it's a concerning area. I think we're keeping close eyes on Victoria, Caroni, St. George East, and Tobago at this point in time. So Candice, that's my clinical update for this morning.
Thank you very much, Dr. Parasram. And as you know, occupancy in the parallel health system is a very important indicator as it relates to COVID-19 management here in Trinidad and Tobago. And we go to Dr. Richards for an update in this regard.
Thank you very much, Candice. Good morning to the Honourable Minister, to the Chief Medical Officer, to members of the viewing and listening public, and to all those tuned in on the various media houses and channels of media. This morning, I would like to present a brief update on the clinical status of the hospitals and step-down facilities in the parallel healthcare system. There are 16 facilities across Trinidad and Tobago with a bed capacity of 1,022 beds. The 7-day rolling average, which represents the average number of cases per day for the last 7 days, is currently 183. This number is used as a predictor for the demand for hospital beds across the 3 levels of care within the next 3 to 5 day period. Next slide. This graph shows the number of admissions and discharges, and again it assists us in confirming the number of the demand for beds within the next 3 to 5 days. And you would have noticed that the gap between the orange line, which represents admissions, and the green line, which represents discharges, has been quite narrow over the last week. However, an uptick was noted on the 4th of August, and we will see the results of that increased number of admissions on that particular date. Next. This is a breakdown of the actual total number of admissions and discharges per week. And you would notice that compared to last week, there were slightly less admissions, but an increased number of discharges. And the next slide would demonstrate the actual numbers that we noted. So between last week and this week, there was a decrease or decline in the total number of net admissions, 136 as opposed to 78 net admissions. And this decrease in net admissions was due to 2 factors: a decrease in the number of actual admissions over the last week and increased number of discharges. These factors are really controlled by the clinical status of the patients. Next slide. We also look at the total number of COVID-positive patients hospitalized within the parallel healthcare system. And we have noticed a consistent trend since on or about the 10th of July. The total number and actual number of patients is currently 380 as of 8 a.m. this morning. And on today's media release at 4 p.m., we would note 301 patients across the 9 hospitals in the parallel healthcare system and 79 across the 7 step-down centers. Again, we noticed a slight uptick on the 4th of August, and that was due to the additional number of net admissions. The overall occupancy of the parallel healthcare facilities, and that's across the 16 facilities, is currently at 37%. And we have noticed a plateauing of a sub 40 occupancy since on or about the 15th of July. Again, an uptick at about 42% on the 4th of August, and this correlates with the entire trend that we've noted. Next slide. Next, please. Okay, so the percentage occupancies across Trinidad and Tobago were also examined, and we noted that the percentage occupancy in Trinidad continues to be under 40%, and that's the red line, which is at 38% today. Tobago showed a slight increase during the week, went up to a peak of 45%, but as of this morning is at 30%. That indicates, of course, that overall 4 out of 10 beds across the parallel healthcare system are currently occupied. We also look at the average weekly percentage occupancy across the hospitals that treat severely and critically ill patients. And the trend continues to be consistent, with only 1 of the 7 hospitals in Trinidad and Tobago exceeding that critical threshold level of 75%. However, this increase is just above the 75% and is at 81% at the Augustus Long Hospital. We also looked at the occupancy across levels of care. I would have indicated earlier that the ward level percentages are somewhere in the vicinity of 37%, while ICU continues to be high at 72%. As of today, the HDU percentages are at 27%. However, the average occupancy across the ICU and the HDU, which care for our very ill patients and require more resources, continue to be high. HDU at 62%. Over the last month, and ICU at 80%. Lastly, As an indicator for the parallel healthcare system and the protection of the traditional healthcare system, we also collate and look at the total number of ill patients requiring transfer at a given time in the traditional accident and emergency centers. And we would notice that since the 9th of July, that number has been low. This morning at the NWRJ centers, 2, the NCRJ, 3 accidents and emergencies, 7, the SWRJ 6, and the ERHA 2. Ladies and gentlemen, vaccination and complete vaccination in tandem with practicing the 3 W's, wash our hands, wear our masks, and watch our distance, are our only armor at this point in time in keeping the number of patients that enter the hospital system on a daily basis. The Honourable Minister will go into details on our vaccination plan, and thank you once again for your attention. Have a good day.
Thank you, Dr. Richards. We go now to the Honourable Terrence Deyalsingh, Minister of Health, his presentation, which will update us on vaccination, and he also has some important statements to make. We go to Minister.
Thank you very much, Candice. Good morning to Trinidad and Tobago. Good morning to members of the media. Nice to be with you on this morning, Saturday, the 7th of August. Good morning to healthcare workers, wherever you are. I really can't start this morning without once again thanking healthcare workers, all categories of staff, for the wonderful, wonderful work you continue to do for Trinidad and Tobago under trying conditions. The vaccination update is as follows. If you could have the first chart. The first chart. The total first doses administered to date as of last night, 415,826, and hopefully most of those will convert to second doses. Total second doses to date, 222,741. So roughly about 30% of the population, they have had their first dose, and roughly 16% of the population have had their second dose and are on the way to full vaccination, that is 2 weeks after receiving their second dose. Next slide, please. So this shows you a graphical representation. So we have met our first target, which is 188,900. We will be setting new targets during the course of this week. What is of concern for us now, if you look at the green line, you will see it is no longer as vertical as it used to be because there is some slowing down. For the past week, the average has been around 4,500 first doses. So that will account for that slowing down in the green line. This is of concern for us, and we continue to urge the population to get vaccinated. We have made it accessible. We have increased reach. It is free. It is now convenient. So we urge persons across the world. This is not only a Trinidad and Tobago phenomenon. It's local, it's regional, it's hemispheric, it's global. To get vaccinated, and do not listen to the conspiracy theories. Do your own research. They are very good, well-known, reputable websites that you can go to. We at the Ministry of Health and the RHAs have continued to meet with you one-on-one. The RHAs are meeting with staff one-on-one, their communities one-on-one. Companies are bringing in doctors for one-on-one conversations. We are dialoguing, and let's just get vaccinated. The second item that I would like to talk about is the rollout of the AstraZeneca vaccines, which we so kindly received from the government and people of Canada. It came in on Thursday, and we normally roll out within 2 to 3 working days of receipt. So, how are we going to roll out these vaccines? Starting from Monday, which is the 9th. The allocation is as follows. So we received 84,000 doses of AstraZeneca vaccines from the government of Canada. 31,330 of these are expiring by the end of August. So we have just under 2 to 3 weeks to get these out into arms. The other 50,700 will be expiring at the end of October 31st. So it fits in basically with the 8 to 12 week window that we have between AstraZeneca first dose and second dose. The allocation is as follows. Tobago has been allocated 4,000. They will start their rollout of AstraZeneca next week, Tuesday or Wednesday. The other sites in Trinidad will start on Monday. At the paddock, they have been allocated 3,000 under the Northwest RHA. At the Napa site, they have also been allocated 3,000. So 2 sites in Port of Spain, within walking distance of each other, you have 6,000 doses there. At the UTT site, under the NCRHA, they have been allocated 5,000 doses. The Racket Center, they have been allocated 4,000 doses. Sangre Grande Civic Center, 2,000 doses. Mayaro Regional Sporting Complex, 1,000 doses. SWRHA Sapa, 10,000 doses. Diwali Nagar, 5,000 doses. And the Atto Boldon Stadium, 5,000 doses. So that allocation brings you up to 42,000 doses. So they are going to start administering these doses in Trinidad on Monday. Communications will go out right after this press conference. At these sites, the population will be afforded 2 options to get these vaccines. Actually 3 options. We have set up a call center which will go live on Sunday, an online appointment system which will go live on Sunday, so you can make appointments at these sites to be vaccinated with these AstraZeneca vaccines. And we will also be accommodating walk-ins. However, priority will be given to persons with appointments, with reservations, either via the call center, which is 800-VAC, 800-8222, or you can make your online appointment, and this information will be in the public domain very soon, www.ttvaccine.com. At this point in time, I would like to thank most sincerely my colleague, Senator Hasselbachas, at the Ministry of Digital Transformation, who is leading this program of the call center and the online vaccination appointment system. So let me repeat. There will be 2 methods of accessing these AstraZeneca vaccines at the 9 mass vaccination sites: call center, online, or walking, but obviously persons with appointments will be prioritized over walk-ins. So we have to shoot these vaccines or administer these vaccines, 42,000, in the shortest possible space of time. What will happen to persons who already have to receive their second dose of AstraZeneca? As the CMO could probably explain, we were also administering AstraZeneca up until June. So some AstraZeneca has to be administered for second doses. These were mainly for public servants who we were vaccinating with first dose AstraZeneca. That will continue at the National Racket Center and UTT campus in Shogwana. So that continues. You already have your appointments. There are many people who want the Sinopharm vaccines. You are not forgotten in all of this. First dose Sinopharm vaccines will continue at all health centers. Just go and get your vaccine. They will continue at the Frankie Boudram Wallerfield International Raceway, the drive-through site, and they will continue at the heliport Chaguaramas drive-through site. So let me just recap. The vaccine rollout plan continues next week, but it picks up some more steam with the AstraZeneca vaccines at 9 sites, all the mass vaccination sites. That starts on Monday via appointment, made either via call center or our online platform. Walk-ins will be accepted, but those with appointments will be prioritized. Everyone with your second dose AstraZeneca appointments, that will be honored at the National Racket Center and the UTT campus in Chaguanas. And first dose Sinopharm continues at the all 109 health centers and the two drive-through sites in Trinidad. So that is where we are with the rollout of the new AstraZeneca plan. Ladies and gentlemen, after consultation with the health team this morning and the Honorable Prime Minister, I am authorized to make the following announcements. But these announcements are in the context that we expect the population to take advantage of being vaccinated. Because as we bring out more and more persons, the risk to society and the risk to your health becomes even more dangerous. From Monday, 9th August, NLCB will be open for business. So from this Monday, all NLCB booths will be open for business, whether it's the play your playway, your scratch, your pick four, pay your bills and all that. But we urge operators and owners of these booths to ensure that masking is there and that social distancing is observed. Please do not allow patrons to congregate around the windows of your booths and cause problems. Let us take this opening as a good sign faith in the confidence that we have in you and each other that we could do the right thing. On the issue of retail, all retail will be opened from Monday, 16th August. From Monday, 16th August, retail operators will be allowed to be open. We ask all retail operators, owners, to use this time, to use this week, to get more and more of your employees vaccinated. And for the public, who are your patrons, you have no control over the public, but we are asking the public who want to go into retail stores, because we are cognizant that school is going to open soon. You want to go into a clothes store, a jewelry store. Customers, you also have a duty to get vaccinated. I want to make a special appeal to retail store owners, mall owners. We looked at some figures presented to us by the Retail Association. I want to thank them for working with us over the past week. I received correspondence from them on Wednesday. There's a disturbing trend of vaccination patterns across many countries around the world, in retail and in business. And the trend is this: almost 90 to 100% of the managerial staff, the supervisory staff, tends to be vaccinated, what you call white-collar workers. We don't have to convince them to be vaccinated. However, where things get a little bit dangerous is at the shop floor level, the blue-collar level. And this is where your sales clerks are interacting with the population. Vaccination rates at those levels tend to drop off precipitously, from as low as 20% to maybe as high as maybe 50%. But it does not match the vaccination rate of their supervisors, people working in admin, and at the executive level. And this is a trend across the world. So we are asking store owners this week, as you prepare to open next week Monday, as retail prepares to open next week Monday, let us work in concert, let us work in partnership, and let us see these vaccination numbers go up significantly for the next week or two. Because for the past week, we only averaged across the board around 4,500 doses. If we can get this up to 10,000, 15,000, it means that it is safer to open on Monday 16th. So we are appealing to employees, sales clerks, delivery persons, cleaners, to follow the lead of your supervisors, follow the lead of your management team. If they took the vaccine, then you can trust them to lead you. But this is a partnership we need now. Similarly, we need, as the Honorable Prime Minister will make further announcements, we need more and more sectors to be vaccinated, which could be reflected in the average numbers that we get. We track all these numbers. So that is my presentation for you this morning. I just want to reiterate that I am concerned, as the Chief Medical Officer is concerned, about 4 areas in the country: St. George East, Caroni, Victoria, and Tobago. If we can get these 4 counties collectively or individually, by leadership at the level of their members of parliament, their councillors, THA, religious leaders, to adhere to the protocols and to get vaccinated, this country could be in a much better position than we are now. So Candice, thank you very much, and we are now open for questions.
Thank you very much, Minister. And as indicated, we go now into the question and answer segment. I think you know the plan, but I'll just repeat. Please ask no more than 2 questions. Ask both questions at the same time and indicate your name and the media house you represent before posing your questions. If we have additional time, of course, we will come back to you. We begin with Guardian Media Limited this morning.
Hi, good morning all. Renuka Singh at the Trinidad Guardian. Minister, I know we've discussed this several times, but there seems to be some misunderstanding with regards to what is the official policy for discharge at the step-down facilities. So I'm hoping you can give us that information so we can put it out there. And secondly, we've had that trajectory and your projected vaccination figures. Are we where you thought we would be or where we should be as it relates to the vaccination numbers? Thank you.
Thank you, Renuka. So I will take the second question. The medical professionals will take the first one about criteria for discharge. No, in one word, we are not happy with the vaccination figures. By now, we should have been touching approximately 500,000 first dose. We are at 415, 826, 30% of the population. So we are working overtime, communicating with people. The RHAs, as you have seen, are now going out door to door. But whilst door to door is good, the yield you get from door to door is very low, as opposed to a mass vac site or a drive-through. But we continue. Every one person that we vaccinate is a life saved. And you know, I'm glad you asked this question, Renuka. If we take up these vaccines now, in 5 weeks, we should be possibly having to report no more deaths. Because you get vaccinated now, you wait 3 weeks for your second dose, and 2 weeks to pass. That is how easy it is to bring down our mortality figures and our ICU and HDU figures. It is so easy. Just get vaccinated. We now have 2 brands of vaccines in the system, 2 excellent vaccines that have been proven internationally to do several things. 1, reduce mortality. 2, reduce severe illness. And 3, reduce your chances of getting into a hospital. All the evidence of vaccines in general, all the WHO vaccines in general, and we have 2 of those now simultaneously, get vaccinated. I will turn over to either the CMO or Dr. Richards to talk about discharge criteria.
So for step down, as you know, now we have moved away, we have community transmission. So the criteria for discharge is a clinical criteria. So basically, if you are well enough to go home based on the clinician's perspective, meaning that you no longer need oxygen, you're maintaining your oxygen saturations without the use of oxygen for a certain period of time, then the clinical decision is taken to allow you to go home with the requisite guidelines. So that's the criteria for a step down. If we have a suspect case, for example, from a repatriate that we think it may be a variant of concern, before we confirm those cases, we have another type of criteria, which is actually a double negative discharge for persons that we suspect a variant of concern. So that's the only variation to the clinical criteria, and those are the two tracks that you follow if you have to be discharged from a step-down facility.
Thank you very much, CMO. We go now to AZP News, please.
Good morning, Priya Vihari, azpnews.com. My first question, Minister, can you just clarify whether the two brands of vaccines would be available at one health center, at different health centers, or would they be like one health center would have the same two brands? And can you just clarify, because I'm sure I'm going to get a lot of questions. Can you clarify that there isn't going to be any mixing of the Sinopharm and the AstraZeneca vaccine? Just to clarify that, please. Thank you very much.
Thank you, Priya. So, the AstraZeneca rollout. Okay. So the reason for choosing 9 mass vaccination sites for the AstraZeneca rollout is because 42,000 doses doesn't allow you to spread out. If you try to do that, it means one site gets 100 doses. It doesn't make sense to spread it too thinly. So we chose the mass vac sites that have the capacity to administer these doses in the shortest pace of time. So I will repeat: Tobago 4,000, Paddock 3,000, UTT Shogunas, Monroe Road 5,000, Racket Center 4,000, Sangre Grande Civic Center 2,000, Mayaro Regional Sporting Complex 1,000, Sapa 10,000, and the Southwest RHA has consistently been the best performing RHA in terms of share numbers. The Napa site, which is run by the Chamber of Commerce and AmCham, 3,000, Diwali Nagar 5,000, and Atto Bolden 5,000. Prior, let me make a point here, and I think the population needs to understand, and I'm glad you raised it. It gives me an opportunity to talk to the population on what it takes to run a mass vac site. It costs whichever entity it is, whether it's a RHA or the Chamber, $75,000 to $100,000 a day to run a mass vac site for the population. So the only return on investment we are asking for is not a monetary return. We are asking for people to come and get vaccinated. Because as you may have seen, we have already consolidated the Center Point Mall into Diwali Nagar. The figures just didn't support the Supermarket Association spending $75,000 to $100,000 per day to operate a mass vac site, and you're only vaccinating 100 people, 200 people, when your capacity is 1,500 to 2,000. So that is what it costs the government through the RHAs. You have the same cost structure, and the private sector, $75,000 to $100,000 a day to run a mass vac sites to give out free vaccines. And all we ask of the population is take advantage of it. It may save your life. Thank you very much for your question, Priya.
Thank you very much. We go now to TTT, please.
Good morning, Terry Brown Campbell from TTT News. My two questions are, what is the schedule now with school reopening in September with the Pfizer vaccine that we're going to be giving to children? We're already in August. And my second question is with regard to the Siwa, TT, and Living Waters vaccination on the 1st and 2nd of August? And how many migrants were vaccinated during those 2 days? Thank you.
Thank you very much. So the questions on school reopening, that falls within the domain of the Honorable Minister of Education. I'm sure when she has that information and when we have those vaccines for school children, the appropriate announcement will be made from that quarter. Siwa and Living Waters, they did express some initial disappointment, I believe, last week, Sunday, when they were expecting a couple thousand persons and 300, I think, came out. I think subsequently they vaccinated 1,005, so those are the figures I could remember off the top of my head. But what the population and all of us need to understand is that with the evolving nature of this virus, today the big concern is the Delta variant. We don't know what the other dangerous variant is going to be tomorrow, the day after. With the evolving nature of this virus, and that is what viruses do, they evolve. It means public health responses are going to have to evolve. How we congregate, how we mix, how we do things. And the best thing we can do now in recognizing that this virus is not going anywhere is to keep our heads calm, do what works around the world. Wash your hands, wear your masks, social distance, get vaccinated, don't congregate, don't expose yourself to dangerous situations in any quarter, any kind of congregation. Don't expose yourself, right? So that is where we are with that. Prior did ask about mixing of vaccines. Sorry, I think he did ask about mixing of vaccines.
No.
Yeah?
I don't think so.
So the only two vaccines that we have now that could be mixed is AstraZeneca, Pfizer, and AstraZeneca, Moderna. Okay? Thank you very much.
Thank you. And the second question about Living Water, the vaccination.
Yeah, I
you did
that.
address
Yes,
it. Okay.
thanks.
My apologies. Let's go now to TV6, please.
Hi, good morning. Cindy Raghuba, Singh, TV6. Minister, just if you could clarify, earlier you said the average was 4,500 and you indicated that that was a slowing in terms of the vaccination drive. If you could just say what was the average before, before that slowing of 4,500, I think it was weekly, you said. Are you all concerned that at that rate, the AstraZeneca that is about to expire won't be utilized and, therefore be wasted as a donation here? And the second question is, when the retail sector was called out to be vaccinated through the mass vaccination sites, do you all have an idea as to how much of that sector came out, numbers in terms of specifically for the retail sector as we're gearing up to have them reopen next week? Thank you.
Thank you, Cindy. Nice to see you from San Fernando on the press conference today. Yeah, so we continue to urge the population to get vaccinated. Some of the feedback we have had over the past month or so is that people wanted choice. Now you do have some degree of choice. So that excuse or that reason, we will see how that plays out. You wanted to know how this average went. At one time, between the 21st of July, 22nd, 23rd, we were averaging 15,000 a day, which was brilliant. Then that cut in half from the 24th, 25th, 26th to about 8,009. That was tolerable. Now, for this week, we are down to 4,005. That is abysmal. That is abysmal. When you consider that the vaccines are now within walking distance, it is free. You don't have to line up. You don't have to make an appointment. Just get vaccinated. On the retail side, as I said, the retail industry did provide some data, and I want to thank them for it. But the data shows that the administrative, executive, managerial levels of retail are heavily vaccinated. But at the shop floor level, which is where the risk is, because those are the persons in close contact with your non-vaccinated colleague, or going to be in contact with your non-vaccinated customers, that is where the risk is. And that is why we are asking that if we could get at the shop floor level, which is where your customer service representatives are, those are the people that we want to see vaccinated this week. So that is why the clarion call goes out today to managers and owners of retail. Talk to your staff. Talk to your staff and get them vaccinated. So when you reopen in a week's time, a more significant portion of that critical element of your workforce is in fact vaccinated to protect their colleagues, but also to be protected from an unvaccinated customer. That is where the real risk is. And that sector, we will have to maybe, because of the evolving nature of the virus we just spoke about, really have to strengthen the protocols to suggest how a customer, because you don't know whether that customer is vaccinated or not, is going to enter your store, your clothes store, your jewelry store, your shoe store. You know, we are, I know it's trite to say it, but we are literally all in this together. An unvaccinated customer speaking to and receiving service from an unvaccinated sales representative is a recipe for disaster. Thank you very much.
Thank you very much. And we go now to a follow-up question, please, from Guardian Media Limited.
Hi, thank you so much. I'm just curious as to if there's been any discussion about in-house dining. We've seen a lot of concerns and complaints raised by the restaurateurs. Some have actually suspended their operations until they've reopened in-house dining. Is there any idea as to when that will be addressed?
Thank you, Renuka. So we don't have a fixed timeline for in-house dining. We consider almost every aspect of the economy. The issue with in-store dining right now, it means taking off your mask. Taking off your mask. And you see that same statistic I gave for retail, that at the upper levels people are vaccinated, the same thing applies to all businesses. So with in-store dining, like all other businesses, the wait staff at that level tend to be more unvaccinated. And you have customers without masks now talking. You have the Delta variant conversation, other variants. The virus is evolving. Let us take big bites in amounts that we can chew and digest. So we bring out retail next week, Monday. Let's see how that goes before we take other bigger steps. Thank you very much, Renuka.
And we have a follow-up question from TTT.
Minister had expressed disappointment in the number of nursing staff and other staff besides the doctors who had gotten vaccinated. Has there been any improvement in the numbers from the nursing staff?
Okay, so I can give you some evidence. We had put aside a day, I believe, last week. CEO Soyafat had engaged and had gotten expressions of interest of 400 staff under ERHA to be vaccinated. On the day that they were supposed to turn up for that special treatment, 20 came. 20. And NCRHA is literally going ward to ward, person to person, to encourage all levels of staff except the doctors. The doctors are over 90 to 95% vaccinated, so we don't have a problem there to be vaccinated. Same thing at all other RHAs, same thing in Tobago. So we are now going literally person to person, ward to ward, to encourage our medical staff, our non-clinical staff, our non-doctor staff, from nurses, patient care escorts, lab techs. The percentages vary across the different professions, but generally, outside of the doctors, the level of vaccination at those levels tend to be between 30 to 50%. But we care so deeply for them that we are not giving up on them. We will never give up on them. We will continue to engage them, dialogue with them, inform them, educate them to help them make the best decision for themselves, their families, and their patients.
Thank you, Minister. And we go to AZP News now for another follow-up question.
Hi, morning again, Priya Bihari, AZP News. Minister, when you say no, all retail open, does it include casinos and what about beaches and sport, both non-contact and contact sport?
So thank you, Priya. So retail means exactly that, retail stores, not casinos, not beaches, retail stores. Okay, so I hope that clarifies it, and thanks for the opportunity to say it again. Thank you very much.
Okay, and I think I see a follow-up question from TV6. Am I right? TV6, a follow-up question.
Yes, hi. Just one more question. I know the Prime Minister has said, we're not currently considering mandatory vaccination, but Minister, care to comment on what took place in St. Vincent?
Thank you very much. I was wondering when that question will come. So, as a parliamentarian, as a human being, it is never good when we resort to violence. Personally, and speaking on my own behalf and the constituency of St. Joseph, that type of behavior is not to be tolerated or condoned or encouraged. And when I saw it, I'm glad that my worst fears weren't realized, and the Honorable Prime Minister Gonzalez seems to be recovering nicely. And I pray, and I think all of Trinidad and Tobago, we pray for his recovery, and let's wish him the best.
Thank you very much, Minister Deyalsingh, Dr. Parasram, and Dr. Richards, and all those who were involved in ensuring that today's conference was a success. We have come to the end of the conference this morning. Thank you for tuning in. Just a reminder, please follow the 3 W's. Wash your hands, watch your distance, and wear your mask, whether you're vaccinated or not. We all need to follow the guidelines. And as you know, we're beginning another round of AstraZeneca first dose vaccination. And we recommend that you make an appointment to do so. You can go to www.ttvaccine.com. From tomorrow, first thing in the morning, you can make your appointment online. And from Monday, you can call 800-VACC or 8222. If you want to take the risk, please go ahead and walk in. If you're not able to make an appointment, we'll facilitate everyone that we can. Do have a good day, everyone, and be safe.